My name is Amit Mehta. I'm a board certified hematologist and medical oncologist. I live and work in North Carolina, so I'm in the Raleigh, Durham, North Carolina area. My practice is called Premier Hematology and Oncology, and I focus mainly on bleeding disorders, including ITP, immune thrombocytopenia, but that's the scope of my practice in a general sense. I used to work at Duke University previously. So immune thrombocytopenia or ITP in general, what we historically called immune thrombocytopenic purpura, hence the ITP acronym. But immune thrombocytopenia can affect patients of all ages, pediatrics through older adults. So it's a condition that does affect a wide range of ages, number one. It can affect men and women, though there's a slight predilection for women getting it more often than men for reasons that are not fully understood. Roughly about 25,000 people in the United States have it across the country at any given time. And the nature of this condition chiefly is that it's a disorder where the patient's platelet count can go to very low or even dangerous levels. So if the platelets go too low, the platelet cells normally protect your body from bleeding and bruising complications. So therefore, if they go too low, the patient's at risk for bleeding and bruising. And sometimes the bleeding and bruising could become dangerous or life-threatening even in some cases. So rarely patients can even die from bleeding complications, unfortunately. So, besides those key things like bleeding and bruising, other symptoms can also happen to patients. And this is something that we've gained better appreciation for in recent years. That in studies where in a research way, where we really ask patients about what symptoms are they experiencing and is it different than the general population for that same age group or where they live and all that kind of stuff. And what was found is that in addition to the bleeding and bruising symptoms, people can have a lot of other symptoms also, like fatigue. They can have impact on cognitive work hour, concentration kind of issues. So some patients do experience issues maintaining a normal schedule or have to change job functions due to these symptoms. And a lot of psychosocial stressors. So stress, anxiety, depression, things that are in a way sort of part of living with a chronic condition like ITP, that they might have the burden of these kind of conditions where they're stuck with a condition. It can cause symptoms at any time or any day. And so there understandably can be some psychological impact on the patients living with the condition. So, number one, usually they come to medical attention because either they have symptoms like unexplained frequent bruising, unexplained repeated nosebleeds or heavy menstrual cycles or something of that nature leads to medical attention in the first place. Or the primary care physician, for example, may check a blood count and find out that the patient's blood platelet cell is abnormally low. So that's how they might come to medical attention and then get referred to a hematologist like myself and say, okay, well, hey, what's going on? Why is the platelet count this low? What's the cause? And of course, many possible causes could be there for low platelets or thrombocytopenia. ITP happens to be one that we're talking about today, of course, but not the only cause of thrombocytopenia. So that's often what happens, first of all, how they present. Then, as far as managing these conditions, there are various medicines that we've used for many decades, really. I mean, we've used various medications to help patients improve their platelet counts, at least temporarily, and that can work in some cases. But unfortunately, in a lot of cases, though we have medicines that can improve the platelet count, at least temporarily, or even for sometimes longer durations, but eventually it stops working or the patient's having issues maintaining a stable platelet count on the treatment they were on and they wind up changing therapies. So there was an interesting study done just a few years ago. What was found in this particular publication was that roughly 50% of patients will change therapies multiple times over the years. So what it tells me as a physician, as a hematologist, is that okay, if half of the patients, not everybody, but if half of the patients are requiring a therapy change multiple times, something is still inadequate in our approach and our tools that we have to help patients who have ITP. So that's the basis for why we want to do better, why we want to engage in newer research, newer strategies and tools and therapies that we have to help patients do better, considering the lay of the land as it is right now. That really is the fundamental thing. Like, why is something different? What's different about drug X versus drug Y? And what the key to understanding that, and I think interesting, I believe, for your listeners and medical practitioners, that are tuning in is that just recently, over the past several years, we've gained a much deeper understanding about what is really underlying what we call the immune dysregulation in ITP. So ITP fundamentally, there's an immune imbalance, an immune dysregulation, and that promotes a lot of the symptoms as well as the formation of antibodies in the patient's body against your own platelet cells. So the antibodies attack your own platelet cells, and therefore that's not a good thing. The patient's platelet cells become destroyed and go to these very low levels that we're talking about. So that's this understanding of why this immune dysregulation exactly happens. That appreciation has been improved and refined just in the past few years. And one of the key pathways involved with this immune imbalance in patients with ITP is a pathway called the BTK pathway, which stands for Bruton's tyrosine kinase. But basically, this really was a discovery. I mean, this was something that was unknown until just a few years ago. So it truly is an advance in the understanding and a discovery in the field of ITP. Then why does this immune dysregulation happen? And one of the key regulators of this immune imbalance or balance that should be there is BTK signaling, this BTK pathway. So on that note, just very recently, what you just alluded to, this medicine Wayrilz, it's a oral medication, a pill medication that directly inhibits or counteracts this BTK pathway. So I tell patients that imagine the BTK pathway is this on switch in your body that's causing this immune imbalance, this inflammation, this autoantibodies to form, these antibodies that attack your own platelet cells. Now we want to get it from the on switch down to the off position. And so by this medication, this is a direct oral targeted inhibitor of the BTK pathway. Or a very simple way some people call it in the medical field is a BTK inhibitor. In other words, it counteracts this pathway that is abnormally active in patients with ITP, and we're now able to try to inhibit it or counteract it or turn it off by giving this medication. And like all these things, of course, clinical studies are done, to see does it indeed work. I mean, the idea sounds nice, but does the medicine indeed work? And of course, as you know, large clinical trials are done. So for this particular Wayrilz medication, large clinical trials were done, phase 3 randomized international studies were done to find out does the medicine indeed work in patients with immune thrombocytopenia. And the answer, and we can go more into it, but the answer was yes, that patients can get a rapid and sustained platelet count improvement by Wayrilz therapy. Just a few weeks ago, the Wayrilz FDA approval was specifically, and I'm speaking here also on behalf of Sanofi, officially knowing what their approval is, and their process was that Wayrilz has been approved for adult patients with persistent or chronic ITP who have had an insufficient response to at least a previous therapy. So as long as they've had at least some previous therapy, the response has been insufficient and they have ongoing ITP, Wayrilz is approved for those adult patients who have that particular situation. That's the FDA label for Wayrilz as it's been approved in the United States. The study, again, was a phase 3 randomized international study. So one of these big studies we like to see in medical treatment to find out does a medicine truly work for a given patient population. Interestingly enough, by the way, the largest randomized trial in ITP done to date was this particular study. The name of the study was called Luna 3, published in the Blood Journal, one of our most prominent journals in the hematology field. And they studied these patients to find out, does Wayrilz treatment versus a control arm, does the Wayrilz treatment work better for raising platelet counts in a durable, sustained way? And what was found in these over roughly slightly more than 200 patients was that 23% of patients had a sustained, durable improvement in platelet counts by getting Wayrilz treatment. On the control arm, nobody did. So it is 23% versus 0%. The statistics were significant where the p-value was less than 0.0001. And the way the study was done is that they kind of had two parts to it. The first part was, does the medicine even work? Where we want to continue the therapy and then find out what is the percentage that stay responding in this durable fashion. And that was this 23% number. But in the initial phase, roughly 2/3 responded at all. So 2/3 did respond. The majority did respond. And out of those, 23% maintained a durable response in this definition they used on the study. They had specific definitions for what they counted. The key part of it was that the platelet count stayed over 50,000 in platelet number for at least 2/3 of the platelet counts that were tested on the clinical study. So those are some of the details in the trial. Now, like all these studies, they also look at secondary endpoints. So they also looked at other factors. I mentioned some of the other symptoms patients can have, quality of life symptoms, fatigue symptoms, and those kind of things. So they also looked at those endpoints also, not as the main endpoint of the study, but secondary endpoints to find out do those things also, can they be stabilized or improved on Wayrilz therapy as well. And the other big thing with the study is, of course, the side effect piece of the puzzle. So, like any medicine, Wayrilz could have side effects that could happen for patients, and that's where all of us have to be aware. Any of us that are, in hematology practice as a medical provider. And some of the key side effects that were seen on the clinical trial were nausea, headache, diarrhea, abdominal pain. Those were four of the main, most common ones that were seen. We also watched patients for signs of infection, including serious infection. So infection could happen, and it has to be monitored for signs and symptoms of infection and then treated as appropriate. And also, patients have to be monitored for liver function testing, though there were no serious or fatal liver problems that emerged. But the medicine is a liver metabolized medication. Liver function testing is the recommended practice for safety monitoring. And the last main thing to mention about the safety angle is that embryo-fetal toxicity is a possibility. So for women of childbearing age who have ITP, we do recommend effective contraception while on Wayrilz and for at least 1 week after the last dose of Wayrilz. And if they are a woman of childbearing age considering starting therapy, the standard practice would be to check a pregnancy test before initiating Wayrilz if you chose that for the patient. I think the main take-home message, in my view, is that ITP fundamentally has been a complex condition in terms of our management and our treatment. It's often been frustrating that patients can respond, at least for a while, but then they stop responding. They require treatment changes. Other symptoms continue in the patient. And the patients are stuck with a chronic disease. They are stuck with the burden of living with a chronic disease. So that's really why there is this so-called unmet need. I mean, there truly is a need for advances in treatment. So I think number one, the fact that we now have a better understanding of the biology problems inside the patient's body, what's really happening, causing the condition, this immune dysregulation, and like I mentioned earlier, the really quite interesting scientifically and medically speaking, the discovery that the BTK pathway is one of the key regulators of this immune imbalance. So that's what's really exciting for us in practice and just the medical science field in general, that we are now able to not only know that this BTK pathway underlies or drives a lot of this immune dysregulation, but furthermore, importantly, that we now have a treatment that is FDA approved that can now actually work to directly inhibit or counteract this pathway. So the fact that we can take advantage of this knowledge, use this refined understanding, and now help patients by directly targeting this pathway that is not functioning properly, this BTK pathway, and sort of reset it or get it back to where it should be, that is really exciting advance that we now have an important treatment that can directly treat the underlying cause of the condition. The root cause of the condition can be targeted much more directly by Wayrilz therapy, something that we did not have available until just very, very recently. Well, I think the main topic or the main last point I would mention very briefly is that patients who have low platelet counts or abnormal or easy bruisability, I tell patients all the time, this is not normal. It's one thing to have a bruise that you know why it happened. You bumped into something and, you could get a bruise that could happen to anybody. Anybody could have a nosebleed once in a while. But if you're having repeated bleeding without explanation, repeated bruising without explanation, and the reference I give patients is that if you have spontaneous bruising or bruising happening without any idea why it's occurring, it's just showing up on your body somewhere, and they're a quarter size, the size of a quarter or bigger, then that's not normal. Talk to a medical provider. And the very simple way to at least take the first step in diagnosis, potentially, whatever the cause may be, would be just getting a complete blood count or CBC. So single tube of blood, very easy to check for any patient around the country. And this can quickly potentially diagnose what could be a serious problem. So I encourage patients, take it seriously if there is bleeding or bruising persisting and continuing without explanation. Very simple to get the analysis done by a single tube of blood, and hopefully that way you can get to medical attention for those folks who need it.